Hello everyone and welcome to your ICD-10 CM Coding Guidelines Review. Today we're going to be looking at Chapter 5 of our ICD-10 CM Guidelines, which focuses on mental, behavioral, and neurodevelopmental disorders, which falls under the code family of F01 through F99. Our first two guidelines are related to pain disorders that are related to psychological factors. In this particular area, we have two codes of concern. F45.41, which is utilized for pain that is exclusively related to a psychological disorder. Of note, there is an excludes one note under category G89 that lets us know that G89 should not be assigned with F45.41. We also have F45.42, which is pain disorders with a related psychological factor. This code should be used with the code from category G89 if there is no documentation of a psychological component for a patient with acute or chronic pain. Next up, we're going to look at our mental and behavioral disorders due to psychoactive substance use, starting with the guidelines for in remission. In terms of reporting the codes with a status of in remission, we must remember that we must have the provider's clinical judgment as to whether or not a condition is in fact in remission. Now, of note, in remission does require the clinical judgment of the physician or provider unless the code set tells us differently. In those instances when the patient has mild substance use disorders in early or sustained remission, those are going to be coded to substance abuse in remission. If a patient has moderate or severe substance use disorders in early or sustained remission, those are going to be coded to substance dependence in remission. Next up, one of my favorite areas, which is substance use, abuse, and dependence. So when the provider documentation refers to use, abuse, and dependence of the same substance, we are to only report one code. And guys, when I first read this guideline, I said, wow, there's so much going on here. It was quite confusing, but then I realized that there was a theme. So number one, if the provider documents use and abuse, is coded to abuse. If he says abuse and dependence, it's dependence. Use, abuse, and dependence, dependence. Use and dependence is coded as dependence. So what I found is it's either abuse or it's dependence. Next up, we have psychoactive substance use unspecified. Well, here again, we are going to rely on the provider's documentation of these conditions. And we also want to remember that we're only going to report these conditions when they are meeting the requirements for a reportable diagnosis. And so they are only to be used, and these are unspecified codes, they're only to be used when the psychoactive substance use is associated with a physical, mental, or behavioral disorder. And the relationship has to be documented by the provider. All right, our last guideline for Chapter 5 is for fictitious disorder, also known as Munchausen syndrome. So this particular syndrome is when the patient or person falsely reports or causes his or her own physical or physiological signs or symptoms. In these cases, if it's documented, we're going to be using code F68.1. Now, we do have this Munchausen syndrome by proxy, and what that means is that the caregiver, also known as a perpetrator, falsely reports or causes an illness or injury in another person, referred to as the victim, under his or her care. This is that they've imposed this condition on another person. And so it's this fictitious disorder by proxy. In those cases, we're going to use F68.8. For a victim of a patient that's suffering from the condition by proxy, we are also going to be reporting a code from the T74 category or the T76. T74 is for adult and child abuse, neglect, and other maltreatment. And then T76 is adult and child abuse, neglect, and other maltreatment suspected. So T74 is confirmed, T76 is suspected. Well, guys, thank you so much for listening, and check back soon for our next chapter-specific guideline coding review. Happy coding!